What color is implantation bleeding?
Hello and welcome to our discussion on a fascinating and important topic in reproductive health, implantation bleeding. This is a phenomenon that occurs early in pregnancy, often before a woman knows she's pregnant. One characteristic we'll focus on today is the color of implantation bleeding.
What is implantation bleeding?
Implantation bleeding is a type of bleeding that can occur when a fertilized egg, or embryo, attaches itself to the wall of the uterus. This usually happens about 6 to 12 days after conception, close to the time when a regular menstrual period would typically start, leading to some confusion at times. The bleeding is generally quite light, and not every woman will experience it.
What color is implantation bleeding?
The color of implantation bleeding can be a key clue to its identification. Unlike the fresh red color seen in normal menstrual bleeding, implantation bleeding is typically lighter in color. It tends to be a pinkish or brownish discharge. This is because it's not fresh blood and it may take some time to exit the body. The brownish color implies that the blood is older.
How long does implantation bleeding last?
Another distinguishing factor is the duration of implantation bleeding. Generally, it does not last very long. It can last anywhere from a few hours to a few days, but typically it's shorter than a normal menstrual period. The amount of blood is also usually less than a period. That's a brief overview of implantation bleeding, its color, and duration. Just remember that it typically presents as a light pinkish or brownish discharge and is usually shorter in duration than a regular menstrual period. Keep in mind, every woman's body is different, and these descriptions might not fit everyone's experience. If you have any concerns about your health, it's always best to consult a healthcare professional. Thanks for tuning in, and we hope this information has been helpful to you.